Hello everyone, my name is Bernadette Fernandez, a registered practical nurse currently taking up nephrology nursing at Hamburg College. We have different types of peritoneal dialysis catheter. We have the Tenkoff catheter, Swan neck catheter, Toronto Western Hospital catheter, and Moncrief Popovic catheter. But let me discuss to you the Tenkoff catheter. Tenkoff catheter comes in straight and curled catheter. It is the most popular and widely used type of peritoneal dialysis catheter. It is inserted through local or general anesthesia. Once it's inserted, it lies between your organs in your peritoneal cavity. And the tip of the catheter sits in your pelvis between the bladder and the lower part of your bowel. This catheter is commonly made of silicone and it is considered to have three segment parts. The external segment, which is located outside the body, which is visible to us. The tunnel segment, which is the part of the catheter that is tunneled inside the subcutaneous tissue between the rectus muscle. And the third part is the intraperitoneal segment, which is inside the peritoneal cavity. The BT catheter are inserted by the surgeon, by a nephrologist, or a interventional radiologist who is trained with the insertion of catheters. And in the insertion of the catheter, they use different techniques: surgical technique, laparoscopic technique, or percutaneous technique. It is very important to collaborate with the patient prior to the surgery to promote care and self-management. It is also important to consider the patient's lifestyle, work, and habits. For insertion care, the catheter should be inserted 2 weeks before the start of peritoneal dialysis to promote tissue ingrowth to prevent dialysate leakage. Presence of hernia should be assessed prior to the surgery in order to have hernia repair or plan ahead on what to do for the hernia. We also have to assess or determine the exit site. We have to plan ahead. So, in order to do this, the patient should be assessed. In determining the PD exit site, the patient should be assessed, dressed in sitting and standing position. An expert nurse or a trained nurse will use a marking pen in the abdomen, avoiding the shirt and waistband or the areas wherein the shirt and waistband lies. And it is also important to consider stomas, bladder incontinence, the desire for tub baths in choosing an exit site. The exit site should be visible to the patient and should be in an area in the abdomen wherein the patient can reach to perform exit care. Preoperative care are the following. Patient should take a shower. Patient should take a laxative the day before the surgery because it is known that the common PD catheter cause of failure is constipation. It is also important to do the Staphylococcus aureus screening to prevent exit site infection. Laboratory values and holding blood thinners can prevent bleeding